Thank you. So as we near the end of this presentation, I'll just talk very quickly about this one last condition that may be more familiar to a small proportion of the audience, and this is called the bicuspid aortic valve. So what we can see on the right side of this picture, you can see that there's this Mercedes-Benz sign that's actually a normal tricuspid valve, aortic valve, where it has three leaflets. But some patients are actually born with the condition right below that, where there is actually only 2 out of 3 of these leaflets forming the aortic valve. And that is the door that separates the heart from this big pipe that we've talked about all morning, the aorta. And so this is a condition that people are born with. Unfortunately, once again, affecting men more than women, and it's about 1 to 2% of the population. And why this is a condition that is relevant for us is because that this is fundamentally not a totally normal valve. So it may work well when patients are young, even in early adulthood. But what we know is that these valves tend to end up causing problems over time. So either they become very narrow, what we call aortic stenosis, or the valve leaflets start to malfunction, and then there's backflow, what we call regurgitation of blood flow in the opposite direction, as opposed to into the aorta that we want the blood to flow. Also, with time, they can cause also aortic aneurysms, this dilation of this aorta beyond this valve. So patients may have some shortness of breath, they may have chest pain, they may faint, but really heart failure is a very late sign, what we want to avoid seeing for the first time. And so why is it relevant? As we mentioned, most of these patients live on to have healthy lives, but they do need ongoing heart specialist follow-up. So this comes in the form of an ultrasound of the heart called an echocardiogram. This looks carefully at the valve function, at the heart function, as well as the aorta close to the heart. And also the same kind of lifestyle measures are important, such as staying active. But it is important for us to once again recognize if there's any abnormal aorta,